Welcome to today's episode. We're diving into high blood pressure, what it is, why it matters, and what really causes it.
Absolutely. High blood pressure, or hypertension, is often called the silent killer. Many people have no idea they even have it.
Right? I find it a bit scary that you can feel perfectly fine, but still be at risk. Why do you think it's so hard to notice?
Well, most people don't experience any symptoms at all until it's really severe. Sometimes people might get headaches or dizziness, but that's rare.
It's like a ninja of health problems. Quiet, but dangerous. So what exactly counts as high blood pressure?
Generally, if your blood pressure is consistently 130/80 mmHg or higher, it's considered high. The top number is your systolic pressure, and the bottom is diastolic.
I always mix those up. Systolic is when the heart beats, and diastolic is when it rests, right?
Exactly. Think of systolic as the action movie moment, and diastolic as the quiet scene. But both numbers matter.
Speaking of which, what's actually causing blood pressure to go up in the first place?
There are so many factors. Genetics play a big role. If your parents have hypertension, your risk is higher. But lifestyle is huge too.
So, things like eating too much salt, not exercising, and being overweight can all raise your risk?
Yes, and don't forget about stress. Chronic stress can push your numbers up, though maybe not as dramatically as other factors.
I've heard even poor sleep can have an impact. Is that true?
Definitely. Not getting enough sleep or having conditions like sleep apnea can make your blood pressure rise.
It's interesting how interconnected everything is. Even things like smoking and drinking too much alcohol are risks, right?
Absolutely. Smoking damages your blood vessels, and too much alcohol can raise your pressure over time. Sometimes people think a glass of wine is good, but moderation is key.
What about family history? If it runs in your family, are you doomed?
Not at all. Genetics are important, but healthy habits can make a huge difference. It's like having a map. Just because the route is tough doesn't mean you can't get to a good destination.
I like that analogy. So even if your family has a history, you can still take control?
For sure. Diet and exercise are your best friends here. Reducing salt, eating more fruits and veggies, and staying active all help.
I've always wondered, can you actually feel when your blood pressure is high? Like with a fast heartbeat or sweating?
Most of the time, no. That's why it's so sneaky. Some people might get a headache, but it's not reliable. Regular checkups are the best way to know.
That explains why doctors are always so insistent on checking it during appointments.
Yeah, and those machines at the pharmacy aren't just for fun. It's a quick way to spot problems before they get worse.
What about specific symptoms? Are there any red flags that mean it's really serious?
Yes, but those usually show up when blood pressure is dangerously high. Things like chest pain, shortness of breath, or vision changes are warning signs.
So if you have those symptoms, it's best to get medical help right away.
Exactly. Don't wait. It could be a sign of a hypertensive crisis.
Now, let's talk about causes that people might not expect. Can medications make blood pressure worse?
Yes, some medications, like certain painkillers, decongestants, and even birth control, can increase blood pressure.
That's surprising. So, if you're on medication, it's worth asking your doctor about side effects.
Definitely. Always good to double check, especially if you notice changes in your numbers.
Switching gears a bit, do you think high blood pressure is becoming more common these days?
Sadly, yes. With more processed foods and sedentary lifestyles, we're seeing it in younger people too.
That's concerning. I remember reading that almost half of adults in the US have high blood pressure.
That's true. And many don't even know it. Early detection is really important.
It seems like such a simple thing, just a blood pressure cuff, but it can make a huge difference.
Absolutely. Prevention is so much easier than treatment down the line.
Besides diet and exercise, are there any small daily habits that can help lower risk?
Even small changes help. For example, walking more, managing stress, cutting back on caffeine. These can all make a difference.
I always think about how laughter and relaxation can help too. Maybe we should prescribe more comedy and less stress.
Hey, laughter might not replace medication, but it's definitely good for your heart.
There's something to that. To wrap up, what's your top tip for someone worried about high blood pressure?
Get it checked regularly and don't ignore it. Small changes add up, so start with one thing, like reducing salt or walking daily.
That's great advice. And remember, listeners, high blood pressure may be silent, but with the right steps, you can keep it under control.
Absolutely. Take care of yourselves and don't forget to check those numbers.
Thanks for joining us. Until next time, stay healthy and curious.
See you next episode.